Welcome back. Later in the show, 1 in 500 people globally are affected by high cholesterol. We'll bring you the latest on this condition and how it can be managed. And of course, Derek is back with his desk exercises, that is exercises you can do from the comfort of your desk. But first, ask any parent, that's exactly what children do when you give them medication they don't like. Now imagine if it's HIV medication, which was actually designed for adults and not for little ones. Well, Wits scientists are at the very cutting edge of drug delivery technology, and they are changing all of that. Anyone who has ever tried to give a small child medicine knows how difficult it can be. For the mothers of HIV-positive babies and toddlers, it becomes a recurrent daily battle. And it's a battle fought by thousands of mothers, according to Dr. Francesca Conradi, a doctor specializing in HIV.
In this province, which is Gauteng, 60,000 infected children, which is the number of children that will fit into Ellis Park.
Since antiretrovirals have become widely available, HIV is no longer a death sentence. Of course, provided those infected with the virus take their medication as required. But how easy is it for little children to be compliant? Professor Ashraf Kavadia, a specialist in treating pediatric HIV, is all too familiar with the challenges.
Drugs are usually developed with adults first in mind, and the drug companies go with the development of formulations that suit adults that generally form the large majority of diseases.
Although some of the antiretrovirals are now available in syrup form, these syrups need refrigeration and others are still only available as capsules and tablets. They then need to be broken and mixed with milk or water.
You have problems of the amount of drug that may be absorbed once it's been reconstituted, because it wasn't designed to be given as a suspension. It was meant to be taken whole as a tablet. And so these are challenges which we're facing. We really have no choice in many cases but to administer them in that way, but they're not ideal.
The medicines taste absolutely disgusting. Some of them are small volumes and some are big volumes, and we have to force these down little children's throats.
It's a problem that Professor Vinesh Pillai, a pharmaceutical specialist at Wits Medical School, and his team have been grappling with.
We are developing novel technologies or strategies to introduce drugs into the body in a different manner that would produce a more efficient effect in the human body.
They've come up with a homegrown solution to get children to take their antiretrovirals in the form of a wafer, which can be placed under the tongue or in the side of the cheek.
A gel is immediately formed on the side of the cheek. Now, this gel acts as a barrier. The barrier, in other words, for drug to efflux back into the mouth. So you get preferential diffusion or movement of drug from the gel across the cheek directly into the bloodstream.
The benefit is that it avoids being broken down by the acid in the stomach and the enzymes in the liver. It's faster, it's more effective, and more drug gets into the blood. They're also working on making the wafer tasteless.
These taste-masking substances essentially are sort of large molecules that capture the drug within that, so the baby itself doesn't have to taste even the drug, because that's the first and most important thing for a child. If it hates the taste, it spits it out.
Another benefit of this new wafer system is that the different drugs needed can be layered into the wafer, making it an all-in-one solution, and there's no need to take a range of different medicines. How's this going to change the treatment of children with HIV?
All in all, what we're looking at is better treatment modality, a better dosage form. If you have a better dosage form, you have better compliance. If you have better patient compliance, you have better and more effective management of the disease.
In the future, this wafer matrix technology can be adapted to administer medicine to children with a wide range of life-threatening illnesses that are currently difficult to treat. It's wonderful to see South Africans leading the way when it comes to technological advances. Oh, really, it is still here. Now, why not swap your desk chair for a balance ball? You guessed it, Derek is back with more of his desk exercises next. Now, here's what's on Carte Blanche Consumer this Thursday.
paying your Visa card installment with your MasterCard, or trying to fill the gaps with any one of your 19 credit cards. As a product of the new Credit Act, debt counseling was introduced to help over-indebted consumers. But with unscrupulous debt counselors and greedy credit providers, the process seems flawed. We investigate this Thursday at 7.